Calabrese here. This is my cancer story and journey. This is video 8. This week is my first week without having to have chemotherapy. So, yahoo. I had my last treatment last Monday, and I did a quick video of that. I actually snuck away to the ladies' room to show you exactly, hi Maria, hi Annette, to show you exactly, hey Stephanie, to show you guys exactly how they administer the chemotherapy. So I didn't really get to talk too much then because, as I said, I was actually at the treatment center, and I know that I wasn't supposed to be doing that, but I figured, as I said, it was my last treatment, and I treated them to lunch just a couple hours before, so I didn't think they would throw me out. But anyway, I wanted to kind of just give everybody an update and let you know how things are going. So this is my first week off of chemotherapy. The side effects are still here. I am actually especially tired. And the mental tasting in the mouth, the loss of appetite is still present. But that is to be expected. At my last treatment, I talked to my doctor, and she discussed, she said, she pretty much kind of anticipated some of my questions and said, just want to let you know, here's what to expect moving forward. So she started talking to me about the fact that I'm going to be very tired, probably even more tired than I was during chemo, which is kind of a little hard to believe. But then when she went on to explain why, it made a whole lot of sense. So she said, you're probably going to get very emotional. And I actually admitted to her that it had already started. Probably on my 10th treatment of Toxel, so I had only 2 more treatments left to go, I noticed myself getting irritated, being just very sensitive, just, crying at the drop of the hat. I'm getting teary-eyed right now. And she said that's very normal. She said, when you're told that you have to fight, especially in your case, see, it's starting. The waterworks are going to happen. If you're been told that you have to fight for, especially in your case, for 6 months, and it's going to be a tough battle, you put up, these walls, this strength, this whatever that really protects you. But when it's at the end, you can kind of see the rainbow at the end of the tunnel or whatever, it's kind of in sight now. That wall starts to, slowly drop off or get weaker, I guess. So you then start to think about the hell that you had to go through. And, so that's what happens. So you just, get emotional, and you now can let it go. So, she was right. That's exactly what's happening. So I waited purposely this amount of time to do this video, to try to, so that I could be able to talk, because I will tell you that the day of my last treatment, I cried all day. I mean, and it was like it should have been happy, happy, happy. And I was, but at the same time, it's like she said, you just got through this hell, and you're still standing. So I couldn't get out of the Lever Center fast enough to get in my car so I could bawl my eyes out, which I did. And then I drove home, and I was home alone, which is how I like it. Don't particularly care to share emotion. Can't believe I'm doing it here, but it is what it is, right? It's a live video. Bawled my eyes out at home, And of course, you know, there were friends that knew that today was my last day. And doorbell rings, I get flower delivery. Doorbell rings, I get another flower delivery. So of course, that kind of snapped me out of my funk, and got me, you know, realizing that it's okay. And I have to thank my doctor for being proactive and letting me know this, because I was actually already concerned about it, because I'm really strong, as you all know, and the fact that I'm like, why am I feeling this way? Why am I being so emotional? And it was starting to bother me. And when she basically came right out and just said, "This, expect this. This is just you." Thanks, Shelley. This is just you. Your body and your mind now can actually just relax and just let, you know, the emotions can actually now start to filter through. So I'm happy that she gave me that information, because if she hadn't, I think it would have been worrisome for me. So, but anyway, she also told me what other things to expect. Certainly, she said the tiredness is going to continue for a while. Basically, I'm going through chemo detox. Didn't know there was such a thing, but they don't like to tell you that while you're fighting, because they want you concentrating on fighting. They don't want to have you worry about what is chemo detox all about. So, which I totally understand. But basically, she says, you know, the symptoms aren't going to change. They're going to kind of stay the same for a little bit longer. The other, in regards to my fingernails, I asked her, now that I'm done with chemo, if this is going to reverse, and she said they're probably going to get worse for the next few weeks. So I'm probably going to lose them, because they're really bad. I don't know if you could see this, but they're turning black. My thumbs, this one is actually curling on the side here. It's actually coming off already. And and then the first two as well, they're starting. And they're tender. I can't really use my hands like to grab things. I feel like if I do that, they're going to pop off, and that just scares the heck out of me. So, so I have to deal with that, but they say they will grow back. So it is what it is. The other thing that happened is a few days after my last treatment, I noticed that my legs were swelling up. So I called the doctor. They had me come back in, and this is my oncologist. They had me come back in and check me out. She sent me to go get an ultrasound done, because they were worried. Another side effect is blood clots, so they were worried about that. So I had ultrasound done. Good news is there were no blood clots, so that was good. And I guess the conclusion was that, once again, just another side effect of chemotherapy, especially somebody that's been on it for so long, your body is just not working the way it's supposed to. So, just keep your legs elevated and, try to do some walking in that, which I'm trying to. But again, I just get so tired that it's hard to do that. And that was it. So that was good. So the next thing is, so what's next? I'm done with chemotherapy. What's next? I don't have to have radiation done, because I had the whole tissue removed. I had a mastectomy. So radiation only happens when you still have the tissue left behind that had the cancer. Since I removed the entire tissue, radiation is no longer necessary. I don't have to take any medication after chemotherapy. A lot of women that have breast cancer, a lot of them are hormone created or fueled, whether it's estrogen or progesterone or both, and they have to continue after chemotherapy and or radiation, depending on their surgery type. They have to continue with medication for 10 years, believe it or not. I'm fortunate that I don't have to take the medication. The two common ones are tamoxifen, I believe it's called, and Rumidex. As I said, I'm fortunate that I don't have to take the medication in that respect. But unfortunate reason is because they know it's estrogen, so that's hormone therapy, and that's part of the treatment. Since mine is triple negative, which means that they don't know what created the cancer, that's why I had to go through such an intense regimen of chemotherapy, because they're pretty much throwing the whole bowl of wax at me to basically try to catch anything that might be brewing before it even gets started. So my doctor said that basically the next 2 years are critical for me. They basically are going to watch me like a hawk. And I have to go to the doctor every 3 months and get blood work done. And I think even a mammogram on the other breast. But there's no body scan that they do. I did question them on that, but they try not to do that because actually radiation actually can cause cancer, so every 3 months of that would be kind of intense. So the thing for me now to do is basically just be very aware of my body and report any type of new pains that are, anything that's new to me, particularly any back pain. The thing with triple negative cancer is that it has a high reoccurrence rate, and typically when it does reoccur, it doesn't come back on the breast. It typically comes back on a vital organ, such as either your back, your bones, you know, your brain, your liver, those types of things. So she basically says that you really have to, and that typically happens within the first 2 years. If I could stay clean for 2 years, then the risk factor drops off significantly. So every 3 months to the doctor, they do blood work, which also is, they can test for any cancer in that respect. And again, just be very in tune with my body as far as any pains, which I happen to be. So that's easy for me. I know there's a lot of people that don't or can't or aren't, I should say, as well in tune with their body, but that's something that I am. And that's it. I have no other treatment to do at this point. I am considered cancer-free because once they removed the breast with all the cancer, they removed all the cancer. The chemotherapy, as I said, was done as a proactive thing because it's triple negative to make sure if anything's happening that it's getting killed before got killed before it even got started. So that's what I have to do right now is every 3 months go to the doctor for blood work, just be very in tune with my body, and report anything that's different or new to me, and that's it. So it's sort of a relief. It's also kind of scary because, you know, not doing the scans, I guess, is a little scary, but I understand what they mean by that. Especially since my cancer was stage 1. They typically don't do scans unless you're a late stage cancer. That's all, you know, obviously at a different stage, I guess, is the best way to put it. So that's what I have to do for the next 2 years. I will keep you guys updated at, you know, I probably won't video every 2 weeks, you know, maybe not as often, but anything that I feel is significant to talk about, I will let you know. The good news is the hair has come back, started to grow. I don't know if you could see, but it's really coming in here. Even it wasn't coming in on the top. It actually started growing probably when I had two treatments left. And they say that typically happens. I don't know why, but it typically happens, you know, around towards the end of your Taxol treatment. So along the sides and the back, it's really kind of full, and you can see that it's there. It's completely white, but it's there. I was worried that it wasn't coming in on top. I don't want to have the clown look, you know. So, but it is coming in. You can't see it, but I could feel it. But I'm not happy with the way this is coming in so much quicker than this. So I might even call my friend Patty, my hairdresser, and let's see how, I'm going to wait a couple more weeks and see how this happens, if this catches up to this. If not, believe it or not, I'm going to shave it again and have it start all new from scratch, because the clown look, I don't mind the bald, but the clown look, not so much. So, anyway, I think that's all I have for today. Thank you so much, guys, for tuning in. Remember to share this video. It can help somebody that's going through this. And obviously, I don't share stories of, personal stories that people have reached out to me that have come directly from watching these videos, people I don't know that have reached out to me and, let me know of their stories, reached out to me for advice, reached out to me to just vent, compare notes, and we have helped several people, I will tell you that. I can't name names, but for obvious reasons, but we've helped several people that watched these videos and reached out, and as I said, who are getting ready to blow off their mammogram appointment, caught something, just some serious things have happened, some good things have happened. So nobody wants to be told that they have breast cancer, but to be told that you have breast cancer stage 1 or be told you have breast cancer stage 4, it's a huge difference. I'll take the stage 1. So as I said, they have helped, so please continue to share them, and that's all I have. Thank you, guys. Love you. Thanks for tuning in. Ciao for now. Mwah.